Hi, everyone, and welcome back to the Pandemic in Philly COVID Conversation Series podcast brought to you by the National Nurse-Led Care Consortium in the Greater Philadelphia region. It is bright and early this Wednesday morning. We're recording this session on September 29th, 2021 from Philadelphia, Pennsylvania, hoping to bring you all the latest COVID-19 updates. Kevin, you have your morning cup of coffee ready to go?
Well, Kelsey, I think I told you before, I do not drink coffee for many reasons. It gets me too amped up. I feel every heartbeat. I feel every pulse. It's just too much. So either way, I do drink tea. I drink my tea, have my glass of water. I'm ready to go.
Caffeinated,
mildly
caffeinated,
mildly, yes, mildly, just not too ramped up. I'm just right there above, just not tired. So
right below jittery.
Yes. So like perfect sweet spot. So yeah. Either way, have my tea, have my water, ready to go. How about you?
Amazing.
Coffee?
I finished my first cup of coffie, so I'm a little sad about that, but we'll have to go for a second cup here in just a bit.
There we go.
Yeah, I wanted to start off by kind of sharing with folks on a community health event that I had attended a couple of weeks ago at an elementary school in northern Philadelphia. And it was such a humanizing experience for me because I don't have a bunch of kiddos running around. So really seeing this age group that isn't able to get vaccinated, I think was really important for this line of work and like what we're doing and personalizing that experience a little bit more and seeing what other people are going through with COVID and how this situation is still is layered with complexities.
Yeah, no, I mean, just think about what you just said too, right? One, kids still love having fun. So I know that where you went to was a block party. COVID does not stop. Kids do not stop having fun, right? They still want to get down to it, want to run around, do, moon bounces and different things like that. So kind of seeing like kids still want to be out there. You still want to think about what are some ways that you can protect them? Like, what are some things that you can still do even throughout this pandemic? Like, okay, what can we do to really make them feel safe, even though they themselves cannot get vaccinated? And, I've been thinking about what you said recently too, think about like they put the word almost sometimes like the public in public health, right? Like we need to think about ways to protect them for those who are vulnerable, if they're, too young to get vaccinated, if they're like older adults, different ways that we can protect them as well too. So sometimes like looking at public health, like that to me is sometimes like the way to really look at it and say, all right, these people can't do it. What can we do to protect them? And looking at the kids run around and have fun and still want to be kids, what can we do to really help them be safe? And, as we kind of move forward, just like protect them. So yeah.
All those preventative measures. I think also like what was really special about this was seeing all the kids wearing their masks.
Yeah.
And it was so fun too, like handing out masks designed for kids and showing like the littler ones. There were like a couple of 4-year-olds who came in with their older siblings and all of that good stuff, but showing them like how to put on the masks and all of this stuff. So it was definitely a fun time to be around little kids and parents and to have these conversations and to hand out masks to folks. But I think also this is a really nice segue into what I wanted to share next, which is the hospitalization rate in the United States among children ages 5 through 11, which is this elementary school population. And as we've, already kind of brought up, because this population isn't yet available or able to receive a vaccine, being back at school and having all of these increased exposures, what we're seeing is, from this graph stemming from May 2020 all the way up to this current month, we're seeing hospitalization rates among children rising. And particularly within this graph, we're seeing a rapid rise occurring in August and September, which kind of correlates to that going back to school time. And I know that the CDC has put out some guidance on COVID-19 prevention for school children ages 5 through 11. We should continue vaccinating the unvaccinated, enforce universal indoor masking, maintain physical distance. Routine testing is also really important for this population and for school administrators. And really just to constantly monitor the situation to properly and quickly combat any outbreaks that occur.
Yeah, no, I mean, of course, like that rise, like I said, it's not steady right now. Like it's exponential, right? So, but I did see, like, based off those reports that kind of came out through the CDC, but also through the American Academy of Pediatrics, there was a quote that really stuck out to me when I was reading this article. It said, like, there's an urgent need to collect more data on longer term impacts of the pandemic on children, including ways the virus may harm the long-term physical health of infected children, as well as its emotional and long-term mental health effects. So to me, that is like one of the things that we don't really talk about like enough. Like we know that kids can bounce back. Like if they get COVID-19, they may bounce back, no real severe, like acute, immediate, effects, but we don't know how this thing looks 15, 20 years down the line when it comes to children who may become just infected with COVID-19. So what can we do to like not have that happen so we don't have to see what happens in 15 to 20 years? And I think that's one thing, like with the AAP, when they mention like those long-term effects, we don't want to see it. How can we prevent it? What are things that we can do if they can't get vaccinated? What are things that we can do as those who can get vaccinated to protect them? So end of the day, the word vaccinated will come up multiple times because that is the thing that we're kind of talking about and really pushing towards, because everything is kind of like tailored to that conversation. How do we get people vaccinated, especially for those who can't get vaccinated, because those long-term effects are still not known. We're kind of still within, this fluid conversation or this fluid pandemic. So what can be done in the short term to help out for the long term?
Yeah, I definitely agree with you. I think also, I hope to continue this conversation in the future about mental health among children, as it relates to all of the other ramifications besides disease that's currently happening. And what we've seen during the pandemic are those substantially increased rates of depression and anxiety and mental health disorders, and and other lines of work, opioid use disorders, and the ways in which the pandemic is affecting communities large and wide besides disease ramifications. And I think that's definitely an important conversation to have, as well. And also in terms of mitigating the current pandemic and the current situation we're in, getting ahead of this curve. And so I just wanted to throw that out there too, to folks who are listening right now. If there's any mental health resources or any ways that we can, best assist children in our communities, particularly ages, 0 to 12 to 18. But the best ways to support our children and their mental health during these hard times, and supporting them in their social support structures. Give us some feedback. We have a Google form below. Give us some feedback, and we'd love to present it to future listeners as well. But I also wanted to bring up the Pfizer announcement of their trial, their COVID-19 vaccine trial that was underway in participants 5 through 11 years of age. And that study had demonstrated the vaccine was safe and well tolerated and showed a robust neutralizing antibody response in children ages 5 through 11. So hopefully we'll be seeing some good things in the coming future.
Fingers crossed.
Yeah, fingers crossed. Hopefully this population will be receiving the vaccine soon enough. But I thought this would be a really good time to go into other US data trends, particularly with the adult population as well. Currently in the United States, we're seeing an average of daily new cases over the past 7 days has actually decreased by 17% compared to the previous week. As of September 22nd, there have been a cumulative total of over 42 million COVID-19 reported cases in the United States. And that's just reported cases. Many folks, may not report COVID-19. They may not ever get tested. So having a cumulative total of over 42 million COVID-19 cases in the US is quite crazy. But jumping along, let's go ahead and talk about the number of US deaths and cases on just September 27th alone. US deaths were just over 2,000, and US new cases on September 27th was just over 180,000. So definitely up there, even though we're seeing weekly changes and rates and all of that. I think it's still important to continue these preventative measures because every week is going to look a little bit different from the last. And what we're seeing as well is, according to these data trends, the Delta variant continues to be the predominant variant circulating across the United States. And what we see from this chart here is that 98% or slightly over 98% of cases are due to the Delta variant. So definitely keeping that in mind as well moving forward.
Yeah. And I mean, keeping all these numbers in mind, right? As I've kind of said to you, Kelsey, offline some, previous times, these are a lot of numbers, so many numbers. Like sometimes you don't know what to even do with them. Like you see millions of cases, or you may see 500,000 cases here. And it's like, what do you do with these numbers? And I think overall, what we're kind of just looking at is like, okay, we know there's cases, what can be done about it, right? And of course, number one, I'm back to it again, talking about vaccine doses. I'm like a broken record right now. But either way, just talking about vaccine doses, right? So on September 27th, there was over 500,000 vaccine doses administered. And that points to our total US population who are fully vaccinated at 56%. There's been so much talk about vaccines, so much conversation. We still have a lot of room to grow to get to a place where we feel confident that like, hey, most of the population has been vaccinated. We can feel good now. I think we're still at the point where we're at that line where it may feel like it's plateaued a little bit, even though conversation has not plateaued. It's been everyday, constant conversations, but 56% to me, it needs to creep up. It needs to go higher, right? So
we need to get that herd immunity.
We got to get there. I'm not sure what it's going to take. I know we're going to continue to like do our part here and talk about it, but just as of September 27th, that is what we're looking at now. And of course, there are more conversations around vaccines, of course, talking about boosters. Like that is one thing that we've talked about previously. And also, I'm sure when vaccines were first talked about, it was like, okay, how long will this last? Will we need booster shots? And recommendations came out pretty recently talking about booster shots. So Pfizer booster recommendations. There were about 4 different recommendations that came out. And really, it's not only 4, because there's so much gray area and so many different types of ways where people may feel that they may fit within the booster recommendations. But looking at what's here, we have for the Pfizer vaccine booster recommendation, we have individuals who are 65 years and older and residents in long-term care settings. We also have people age 50 to 64 with certain underlying medical conditions. And I want to underline the word certain, not underline, but also just underline the word certain and look at like it's, once again, it is clear that there is some gray area when it comes to what those medical conditions may be, but always consult your medical professional and consult your family, and also just consult yourself, talk to yourself, because you know yourself better than anybody else, and think about if you may fall within any of these categories. And looking at people who may not be like older adults, right? People 18 to 49 who had high risk for severe COVID-19 due to their certain underlying medical conditions. They may also, receive a booster vaccine shot. So those individuals who you may once again talk to your medical provider to see if you may fall within a range where you're in an increased risk for COVID-19 exposure and transmission because of where you work or your institutional setting. So there's a lot of different avenues and angles to like really think about when it comes to boosters, because looking at the CDC, they say that the protection seems to wane over time, right? Even though it's still really high, it does seem to wane over these last 6 to 8 months with the vaccines. So some kind of like additional protection is needed for certain populations. And it may come to at some point everyone else, but right now, these are the different recommendations as we're kind of looking at it.
Yeah, absolutely. I think a couple other points to add to this as well. is the importance of really, I mean, the booster conversation in general and continued support for different populations in seeking continued immunity against COVID, but also, keeping the most vulnerable population in mind in this and emphasizing the importance of getting the unvaccinated population vaccinated, which is kind of a dual project right now, is boosters and the continuation of getting unvaccinated folks vaccinated, and the priorities there. I think in addition to the Pfizer booster recommendation, just an important note here for viewers that the Moderna and the J&J vaccine will likely need or folks who receive those two vaccines will likely need a booster shot as well, but studies are still ongoing and more information is expected in the next couple of weeks.
Yeah, I mean, and one last thing like about this that also comes to mind is one like kind of quote or study showing that kind of came out, says that most unvaccinated adults see the booster discussion as a sign that vaccines are not working as well as promised, right? While people who are vaccinated see it as a sign that scientists are continuing to find ways to make the vaccines more effective. So sometimes it really comes to like the angle that you're looking at this thing and what you think about vaccines, how you take this information like around boosters. What do you think about it? So if you're unvaccinated, you may think this thing is just not working clearly, so they need more booster shots. But if you are vaccinated, you're saying, hey, they're clearly doing their job to make sure that we continue to stay protected. So it's a interesting like vantage point about which side that you may fall on.
No, that's a very interesting perspective. And I think definitely important moving forward and addressing vaccine hesitancy and vaccine confidence issues, addressing different perspectives and what communication tactics we can take as a general population to help support those individuals who are still making up their minds and who are still indecisive about getting the vaccine and their unique perspectives and life experiences within this regard. I think to also continue on to like different populations and how to best support these populations. I know that you had worked with this organization to create this document. I would love to kind of hear more about it.
Yeah, just quick shout out here. Of course, for this temple work, we have a bunch of different partners, right? So the Philadelphia Chinatown Development Corporation, they put together this amazing Google Excel sheet where folks who want to get vaccinated, they have the different parts of the city where people can get vaccinated, different languages where that may be spoken at these different health clinics and different sites. Also, if it's a walk-in or if it's an appointment. So there's so many different places and so many different opportunities to get vaccinated that, PCDC put us together for you to go. And once again, the different vaccines, the hours are there, everything is there. It's on us now to tell people and for them to get vaccinated. So once again, just a huge shout out. We didn't want to just call this out, and we'll put this in our show notes for individuals to look at and say what part of the city that they're in, that they can pass along this information.
I think this is a beautiful document. I am such a fan. Yeah, big shout out again to PCDC for putting this together. We'll share the link below in the notes for this video here. And also just what a wonderful way to make the vaccine accessible to a variety of individuals based on their location and their language and all of these different methods. So big shout out to them. As we transition kind of here from away from US data and into more local and community data, just looking into Pennsylvania data trends. What we're seeing here is as of September 24th, the rate of COVID-19 cases in Pennsylvania has increased by 3% compared to the previous week. And again, this is just with Delta in mind, the continued severity surrounding the Delta variant and its impact on communities. We're also noticing that the hospitalization rate has increased by 7%. So even though across the United States, we've noticed a decrease in the number of cases, this increase in the number of hospitalization rate is really reflective of the severity of the disease. In addition to these numbers, it's also important to note that 57.4% of Pennsylvanians are fully vaccinated. So this is great. Still lots of improvements to make, definitely making strides, but got to continue getting to that herd immunity space. And then kind of Transitioning gears a little bit to Philadelphia data trends, more local data, we're seeing as of September 28th, the number of cases on that day was just over 2,000. And the percent of eligible population fully vaccinated was 59.6%. And I think just like an important note on this slide here is the percent eligible population. So this doesn't even include children ages 11 and younger. So 59.6% of the eligible population. So definitely still got to make some strides here. It's pretty reflective, pretty comparable to US data trends as well as what we're seeing. So definitely lots of room for growth, but we can get there. And then continuing on here, I really loved this slide. And when we're having this conversation about vaccine hesitancy and vaccine confidence, is really important to note where we can make the biggest adjustments and where we can help support different communities. And what we've seen from data trends regarding different ethnicities and racial groups is as of September 19th, 96% of the Asian population received at least one dose, 74% of the Latino community, 67% of white, and 57% of Black communities. Yeah, I would love to hear your thoughts on this slide as well.
Yeah, no, I mean, this one slide definitely stuck out to me, looking up, different research about in Philadelphia, right? Because we've heard so much about vaccine hesitancy and the reasons why individuals may not be doing it and different things like that. And sometimes when you hear stories, you also want to like kind of correlate that with the numbers, and really seeing, like, we hear a lot of times about like distrust within Black communities around the vaccine. And then we look onto this chart and then we see the weight. Why is it so low compared to compared to everyone else? So it really is, to me, it really hammers home just the inequity when it comes to vaccine access, but also throughout our history when it really comes to, medical distrust. It is one of those things that we have to talk about. And one of the things that we want to, do our outreach and different things like that, we have to keep that in mind when we hear certain things about the vaccine. Is not just a one-off. It really is something that has been brewing up for a very long time. So what are ways that we can combat that? Combat misinformation, really combat, medical racism, right? There's so many different things that we can talk about when it comes to that, because once again, I think I said the last pod, is just like the people with the most to lose are the ones who are not getting vaccinated. So
absolutely,
but also there's reasons why, even if they may not be factually correct, but we have to look at it and say, okay, why does someone feel like this? So, or why does someone think like that, right? So it comes down to what we can do to really hammer on those points. Like I said, whether it's education or appealing to the person's like emotional kind of relationship status when it comes to people who you don't want them to get COVID. How can you help yourself to protect them? So I think it's different avenues and different conversations when we look at those numbers to think, how can we help us as vaccinated to really get everyone else on the same page. So yeah, that was a really interesting just chart right there, because it kind of hammer home some things that I'm thinking about and talking about with some friends and family and different things like that.
Yeah, absolutely. And I think that's what's really important about data trends too, and what they illustrate to public health and medical communities, and what they can tell us moving forward and better adjusting our best practices and quality improvement intervention strategies. And, this data really illustrates to us that, we need to start supporting a lot of communities, a lot of different racial and ethnic populations. And I think the best way to address that is through systemic change and really addressing and honing in on that health inequity issue. So I think that's a beautiful transition into, we definitely want to continue this conversation and hope to continue this conversation in future podcasts. For now, that concludes our September 29th bi-weekly update. And we will see everyone back here next week, where we'll have a wonderful guest, Dr. Vanessa Karamanian, and she will be on to discuss global health equity issues, amongst other things. And I have to say, I cannot wait to have this conversation with her. But alrighty, folks, we'll remember to stay masked, promote social distancing, and get vaccinated. We're here to spread the words, not the germs. Thanks, y'all.
Our team wants to hear from you. Click the link below to share any questions or comments you may have that we can address on our next episode. This series is brought to you by the National Nurse-Led Care Consortium, a nonprofit member organization working to strengthen community health with funding provided by HRSA and the CDC. Updates in COVID-19 response is changing rapidly, so please consult your primary care provider for personalized medical advice.